Vaginal discharge for the past 2 days. Lots of sticky brownish red blood. The dog's gums and tongue were pale and bluish in color. There were signs of toxemia. The chances of survival is 50-50, I said to the father and son. It meant 50% chances of dying on the operating table from the owner's point of view. This was not enough. It ought to be 80%. There was a loss of confidence. Should they send the dog to a famous veterinary surgery? Well, I said, it is not the name of a practice that is important for your dog's survival. It is the expertise of the vet surgeon. Do you have the vet's name to transfer the case to him or her? It is best for me not to handle a case where the owner has a loss of confidence in me. Pale and cyanotic gums and tongue were confirmed by blood tests of very low red and white cell counts, very low platelets. This was a very high anesthetic case, and 50-50 chances given were optimistic. I don't operate immediately, although some vet surgery books advise emergency surgery before the uterus ruptured, spilling pus into the abdomen and killing the dog. The fever had dropped 20 hours after admission. IV drips and antibiotics had been given. The dog had a better chance of survival now. Note the one breast tumor. I would not prolong anesthetic time in removing this tumor at the same time as ovarian hysterectomy. The shorter the surgery, the less risk of dying. What the owner wanted was a dog alive to go home and not passing out dirty blood. Performance was demanded. Swollen uterus taken out. Know what to do to complete the surgery in less than 15 minutes. I used the scalpel to nick the suspensory ligament of the ovary before clamping. Three forceps cranial to ovarian tissues. Double ligation with 2 knot absorbable sutures. The ovary and uterine body were taken. I repeated the procedure on the other ovary. Three forceps method posterior to the uterine body. Double ligation. The ovary and uterus were removed. Stitching of muscles and skin to be done. Cyanosis of tongue and uterus near the end of surgery. Respiration slowed. The dog would die soon. What to do? I terminated isoflurane anesthesia before completion of skin stitches. Oxygen gas given quickly. The dog's tongue changed color from cyanotic to pinkish. She woke up after 5 minutes of oxygen. Owners visited soon. They saw her shivering but were happy to see her alive. Swollen uterus is cystic and contains mucus and pus. This would be a case of closed PYOMETRA. This dog would die at the completion of surgery if signs of deepening cyanosis were not reversed promptly. Dog ate within 24 hours after surgery. She went home after 3 days of nursing. Not all PYOMETRA cases have happy endings. Vets are not God. Now, the dog has another problem, the breast tumor. What should be done? The vet must conduct thorough research to know what to do to reduce the anesthetic risk to produce a favorable outcome. The owner never forgives or forgets when presented with a dead dog on the operating table. Therefore, know what to do if you want to handle such high-risk cases. If not, pass the buck to others. Deaths on the operating table are highly emotional scenarios, and they are not pleasant encounters with many owners who expect vets to be God.